For this lab, you'll start on the hind end, so you can actually leave the front part of your pony bagged, so you don't have to unwrap it and all of that, so you can leave that bagged up. We're going to work on the proximal pelvic limbs on both sides. So here you're going to start with a mid-dorsal incision, so you're basically going to make an incision from about the level of the tubercocci, which you can kind of palpate. It'll be the bony bump right here. And you go from about that level down to the base of the tail, around the base of the tail, down the caudal aspect here, and then you're also going to make a vertical incision down the front side, so the cranial edge of your thigh muscles here. So then you're going to take the skin and reflect it on both sides. So you'll reflect it as one big piece on each side, so just the proximal pelvic limb down to the level of the stifle, and then you can stop reflecting the skin there. And you'll do the same thing on the other side. So we're starting on the left side with the left limb, and the first thing you're going to look for, there's going to be a lot of fascia covering this whole area, so you really have to look for the borders of the muscles before you start cutting anything. So you want to look for the borders of your biceps femoris, which is this muscle right here, and you want to look for the edges. So you kind of want to define that cranial edge, and then you want to define that caudal edge before you start cutting. So you have biceps femoris here. Then semitendinosus is the next muscle here, and semimembranosus is the most caudal one here. So first find your biceps femoris, identify those borders, and then you can cut it. So you're making a proximal incision here and then reflecting the whole muscle. So this is a pretty big muscle, and you want to take the whole thing down, reflect it distally towards that stifle. You'll run into some vessels, and you can just go ahead and cut those as you reflect the muscle distally. And then you're going to do the same thing with your semitendinosus muscle. So you're going to try to identify the border first between the semitendinosus muscle and semimembranosus muscle. Then you'll cut it proximally, and then reflect it similar to your biceps femoris here. So you actually just take that down similar to that biceps femoris, so both of them are reflected towards the stifle. So on your semitendinosus, you can kind of see there are two parts here, and it'll kind of come away as two parts. So don't worry about that. You can just cut both pieces away from the pelvis and then reflect them distally. So then we do a similar thing with the semimembranosus muscle here. So you're going to identify the borders of that if possible and see where the gracilis is versus the semimembranosus. So here, I'll kind of elevate the gracilis off of that. So gracilis is on the medial aspect, and we'll get to that muscle later, but you want to pull that off away from the semimembranosus before you cut it. So semimembranosus you can also cut proximally and then reflect distally, and this is a pretty thick muscle also. And in the pony it will have these two thick parts to it. So if you pull it down, you'll see this nice thick belly here. So there are two bellies to this muscle, and you're going to cut the first one and pull it away, and then you'll have to cut this away also before you can actually pull it further distally. So make sure you're cutting both parts of that muscle to reflect it. Okay, so now we'll work on the gluteals. So you have a superficial gluteal here in the pony, and it's kind of a V-shaped muscle that has two parts to that V, and then in between there's an aponeurosis. So that sheet of fascia is connecting the two parts. So if possible, you want to isolate it and keep part of that aponeurosis with the muscle, but you're going to cut proximally and then reflect distally, just like we've been doing with all the other muscles. So take that, reflect it distally. And one other note on the superficial is that this tensor fasciae latae, this muscle we'll get to a little bit later, but if you want to, you can reflect just this caudal portion of it cranially, and you can get underneath this superficial gluteal a little bit better. So if you need to, you can reflect tensor fasciae latae, reflect your superficial gluteal distally, so we're taking that down like that, and you'll see where it's inserting on this third trochanter here on the femur. The next muscle is a pretty massive muscle in the pony. It's this middle gluteal, and it takes up a lot of space. So when you're cutting through it, be sure you're getting all the way through the muscle because it is very thick. So this whole thing is middle gluteal. And what you want to do here is work your hand underneath the edge and find the separation between the middle gluteal and the accessory gluteal underneath. So as you pull it up, you'll kind of be able to see there's a distinction here between the two different parts. So you're going to do that and then cut in kind of an arching cut around, and then take this whole middle gluteal and reflect it distally. So remember, this is a really big muscle, so there's a lot of muscle tissue there that you have to get through. So all of this is all middle gluteal. So reflect your middle gluteal distally, and then underneath you'll see the accessory gluteal. So here is accessory gluteal, and you'll also reflect that distally. So you're going to cut that proximally up here, away from the pelvis, and reflect it distally. Then here underneath accessory gluteal, we have the deep gluteal muscle. So it's kind of this fan-shaped muscle right here. And that's the deep gluteal muscle. In between your accessory gluteal and the greater trochanter, you have a trochanteric bursa. So that's where the probe is sitting inside. And we'll take a little bit of a closer view of that. So here we'll take a little bit closer up view of that trochanteric bursa that I mentioned. So here is that accessory gluteal, and in between the accessory gluteal, the tendon of it, and the greater trochanter, you have this trochanteric bursa. So basically a fluid-filled pocket here, protecting the bone. So here would be the trochanteric bursa where the probe is. Then while we're in this area, we'll point out the sciatic nerve. So you have this huge nerve coming out here. This is all sciatic nerve coming out. And that comes out of the greater sciatic foramen. So sciatic nerve coming down. You also have the cranial gluteal artery here that you can see coming out with that nerve. And here you can see another artery coming through. That's the caudal gluteal artery. And that actually punctures through this sacrosciatic ligament that you see here, this white sheet. And so that caudal gluteal comes right through that ligament. All right, now we just have one other structure that we need to take a look at, and it's a little bit hidden and hard to see, but we'll take a caudal view of that one. So here we have a caudal view of the pony and that proximal pelvic limb. We've reflected all those muscles, and we're taking a look a little bit deeper where we see the sciatic nerve coming down, coursing distally, and this is the middle gluteal muscle you see here. And right underneath that sciatic nerve, we're looking for this lesser sciatic foramen. So it's that other little hole in that sacrosciatic ligament. So here would be the lesser sciatic foramen. And you have this tendon poking through. So I'll try and put the probe underneath it so you can get a better look at it. That is the tendon of the internal obturator muscle. So that little tendon comes through, and you want to be able to see that. And you may have the sciatic nerve that's kind of in the way, but hopefully you can work around it. So that's the internal obturator tendon that you see there. Now we'll move to the right side and take a look at all of those structures again. So now we're looking at the right side of the pony, where you've done your skin reflection the same as the left side, so skin has been reflected down to the stifle area, and you're looking at the muscles on this proximal pelvic limb. So you have a lot of fascia, again, that has to be removed, and you have to find the borders of the muscles. So here's the border of the biceps femoris muscle. So you'll transect that proximally and then reflect it distally, just like you did on the left side. So here, oops, I'm stuck to my other muscles. There we go. Biceps femoris, you'll reflect it distally. And then you'll have semitendinosus is the next muscle here. So semitendinosus, you'll also cut proximally and reflect distally. And remember, you might have those two heads that you can see that come apart there. So make sure you cut both pieces while you're reflecting distally. Then we have semimembranosus here. So semimembranosus muscle, and you want to define in between semimembranosus and that gracilis muscle on the medial side there. So just make sure you're not cutting gracilis, and then you can cut this proximally, the semimembranosus. Cut that proximally and reflect distally. Again, you have these two pieces, so make sure you're cutting through both of them. All right, and then we'll move on to the gluteals. So you have your superficial gluteal, which is that V-shaped muscle with the aponeurosis in between the two parts of the V. So take a little bit of that aponeurosis with it, cut across, and then reflect distally. So you're cutting proximally, reflecting distally. And again, if you need to, You can move part of this tensor fasciae latae muscle out of the way, so you can just reflect it cranially if you need to get to that other piece of the superficial gluteal here. So here is superficial gluteal, reflect that distally. Then we have the middle gluteal, that big massive muscle here in the pony. Middle gluteal is here, which you'll make an arching cut proximally and then reflect it distally. And you can work your hand underneath to find the differentiation between the middle and the accessory gluteal and then reflect that off. So it's that big thick muscle here is all middle gluteal. Then we see our accessory gluteal underneath. So accessory gluteal is here. You're going to cut that proximally and then reflect that distally as well. And then you see your deep gluteal underneath. So deep gluteal muscle is here, accessory gluteal is here, and then that trochanteric bursa, as you reflect the accessory gluteal, that tendon goes over the greater trochanter, and you have that trochanteric bursa that's filled with fluid. Then here we can also see the sciatic nerve coming out of that greater sciatic foramen. So here's the sciatic nerve. You have the craniogluteal artery coming out, you can see here, and giving off branches to the gluteals. Then you also have your caudal gluteal artery here, and that's coming through that sacrosciatic ligament. So caudal gluteal artery is there. And then if you look caudally, you can see that tendon of the internal obturator. So we may have to take a closer look at that. So here we're taking a caudal view to see that internal obturator tendon coming through the lesser sciatic foramen. So I have the probe underneath the tendon of the internal obturator, and you have the lesser sciatic foramen right here where the probe is kind of sticking through. So lesser sciatic foramen, tendon of internal obturator coming through and running underneath this sciatic nerve. All right, now we're taking a look at the left side again because we need to remove the left limb on the pony. First, you need to cut through the deep gluteal muscle. So you're going to make a cut, an arching cut across the deep gluteal. You're also going to have to cut through your sciatic nerve. So you want to leave a stump so you can see it, but you want to cut it kind of proximally. So we're going to cut through here. You're also going to have to cut through your tensor fasciae latae muscle. So you can go ahead and just cut through and leave a stump that will stay with the body, and then the rest of it will go with the limb. Like that. You'll also have to cut through your internal obturator tendon that you worked so hard to find. That's back here. And then we have to put the pony on the floor into right lateral recumbency, and you'll need an assistant to help you lift the limb while you cut the leg. So now you have your pony down on the floor in right lateral recumbency, and you'll need an assistant to help you. So your assistant will put one foot on the leg that's down. So you can see Anna has her foot right here on the leg, and then she's going to grab this leg and pull up. And as I cut, she's going to keep pulling that leg up to keep pulling it further and further away so I can cut through the rest of the structures that you're going to see down here. So it's very helpful to have an assistant. It's a little harder to do it by yourself, but you're going to go down by the ventral midline. And in the male, you have to be careful because you need the penis to stay with the right side. So make sure you're not cutting through that. And so you have to move just a little bit off midline towards the left limb. And you're going to start cutting. And you're going to cut through the skin and then all of the muscles underneath there. So here we're just going to connect our incision here on the cranial edge so that skin is all cut. And then just keep cutting through. And so we're going to be cutting through structures we have not identified, but that's okay. So you're just going to keep pulling up. And I'm going to cut through the muscles. And hopefully, I'm not in the way too much, and you can see this. So you're cutting through gracilis and adductor. And then you'll eventually get into where the hip joint is, and I'm going to try and show you the accessory ligament of the femoral head. And try not to cut through it before I show it to you. All right. So then we're going to cut through these vessels. Try and find our hip joint here. And I'm cutting through pectineus now. All right, so if you can maybe rotate it up just a little bit. Will it rotate? No. Okay, a little bit more here. So I'm starting to be able to see the hip joint. So if you just kind of use your fingers to palpate where that is, and then kind of cut it open a little bit. Hopefully we'll get a glimpse of that ligament. So I'm just going to try and clean it off a little bit so it's a little more obvious. But I can see it, and I don't think you can yet. All right. So right here, I put the probe underneath it, and hopefully you can see, maybe we can zoom in a little bit, and see that accessory ligament of the femoral head. So the probe is underneath it. And here's your hip joint, so here's the head of the femur, and then this is that accessory ligament right there. Yeah, okay. All right, so then after you see the accessory ligament, you actually need to cut through it so that we can finish removing our left limb. So you will cut through that and then try and rotate the limb out a little bit more and see. So here you can see the lip of the acetabulum, and inside it is the ligament of the head of the femur, which is different than the accessory ligament. But I don't know if we're actually going to be able to see that very well. Let me try and cut through this a little. Okay, so I cut it a little bit to get some rotation. But hopefully, if I put the probe under it, you can see that the ligament of the head of the femur is right there. So attaching to this, which is the head of the femur, and the probe is underneath that ligament of the femoral head. All right, so after you see that, then you have to cut that too. And then you'll hopefully be able to remove your left limb. And just finish cutting through all of the things attaching it. Anything that's left, here I have to cut through iliopsoas. So I got a vessel here that needs to be cut. And then if you start lifting it away, perfect. And we are almost there. And there we go. So now I have detached my left limb, and you can see that hip joint there, that hip socket, and the head of the femur there. So you completely remove it and then bag your left limb separately.